an insertion of these three layers. As you see in this picture, innermost intercostal muscle arises from internal surface of the rib, and in the same direction with the internal intercostal muscles, I mean that the postero-inferior direction attaches to the internal surface of the next rib. For example, if you consider this rib is the 6, from internal surface of the 6 attaches to the internal surface of the 7. The muscular fiber direction is the same with that of the internal intercostal muscle. No. Okay. And internal intercostal muscle, this one, this is the anterior thoracic wall, and we are inside the thorax, and now we are taking a look at the posterior surface of anterior thoracic wall. Okay, this is the internal intercostal muscle on each intercostal space. Okay, as I told you before, arises from the most anterior part of the intercostal space. Alright, and internal intercostal muscle arises from the floor of a costal sulcus, a rib, and attaches to the internal surface of the next rib. For example, from second rib, floor of the costal sulcus of the second rib attaches to the internal surface of the superior border of the next rib, rib 3. And external intercostal muscles arises from external surface of the rib, or lateral margin of the lateral margin or inferior border is better. This arises from inferior border of the, for example, rib 3, and attaches to the superior border of the next rib 4. Okay, from inferior border to superior border of the next. All right. Okay. The next muscles. The next muscle is the transverse thoracic muscle. Transverse thoracic muscle. Transverse thoracic is the same level. With innermost intercostal muscle. Same level, but they are separated from each other. Okay, they are separated from each other, and arises from internal or posterior surface of the sternum in the lower half of this bone. You can see posterior surface of the sternum at its lower half, and arises from xiphoid process. As you see, some of muscular fibers arises from here, and with the same direction and with the same direction of the external intercostal muscle attaches to the rib, internal surface of the rib, 2 to 6, from 2 to 6. Okay, you can see fleshy slits of this muscle extended and toward supralaterally, and attaches to the internal surface of the rib 2 to 6. This is the transverse thoracic muscle, you can see. Because of location of this muscle in the lower part of the thorax, therefore, internal thoracic vessels and its terminal branches is hidden by this muscle in the lower part of the thorax. We can see this vessel, this is the internal thoracic vessels, is hidden whenever the muscle is present. Okay, and on the posterior wall of the thorax, we've got another intrinsic muscle, subcostal muscle. Subcostal muscle arises from the internal surface of the angle of rib, this muscle. Angle of the rib, this muscle, subcostal. This is innermost intercostal. At the place of the costal angle, this muscle arises from internal surface of a rib and attaches to the next two ribs. Attaches to the next two ribs, internal surface of the next two ribs. Sometimes attaches to the next rib and sometimes in the third one. Okay, for example, this is rib 6. Subcostal attaches sometimes to the 7, sometimes to the, like this, attaches to the rib 8. Okay, 2 second or third ribs, but to the next and next one. As you see in this picture, direction of the muscular fibers in this muscle is the same with internal intercostal and innermost intercostal. All of them are the same, the direction of the muscular fibers. And sometimes this muscle is this muscle blends with internal intercostal and innermost intercostal muscle. Alright, the outside of the thorax, you've got but on the posterior wall of the thorax, you've got a levator costarum. This muscle arises from a transverse process of the thoracic vertebra and attaches to the next rib. For example, if its transverse process of the T8, this one, T8, the muscle attaches to the T9, rib 9 and rib 10 sometimes, because levator costarum has two forms, levator costarum brevia, levator costarum longa. Long levator costarum, short levator costarum. Short one attaches to the next rib but the long one attaches to the next rib and then next one. All right. Careful to the insertion of this muscle, you can find it. This is the angle of a rib. If you remember, I told you on the external surface of the rib, angle is indicated by the oblique ridge. And you can see the attachment or insertion of this muscle is between angle and the tubercle. Angle and the tubercle of a rib. Alright. And another muscles is the serratus posterior superior, arises from the neck, ligamentum nuca I show you, and the spinous process of the C7 to T3, and attaches to the by direction of the infralaterally, attaches to the superior border of the ribs 2, 3, and 4. And then we've got another one. The direction of this muscle, serratus posterior inferior, is right to the superior one, and from spinous process of the T11, 12, L1, L2, 4 spinous processes, 4 C7, T1, T2, T3, and the 4 inferior one is the same. The 4 spine is the different location, T11, T12, L1, L2, and attaches to the inferior border of with the direction right to the superior one. I mean that the supralateral direction attaches to the rib 8, 9, 10, 11, and 12. I show you in I show you in this picture. This is the serratus posterior superior, rises from the ligamentum nuca, C7 to T3. Here, spinous process of this one. Direction infralaterally. And serratus posterior inferior is a larger than superior one. Arises from the 4 spinous process, T11, T12, L1, L2, and attaches, this muscle attaches to the 10 ribs, but this one 4 ribs attachment of the location of this muscle. They are serratus posterior superior is elevator of the ribs, elevator of the superior part of the thorax, and the serratus posterior inferior is depressor of the lower ribs. Depressor of the lower. By contraction of this muscle, lower ribs move inframedially, depressed. They are depressed because of action of this muscle. And during inspiration and expiration, the action of this muscle determine, action of these muscles determine elevation and depression of the ribs in the thorax. During inspiration, serratus posterior superior contracts, and the upper ribs is fixed because of action of this muscle. Skeletal muscle will be fixed. Okay, and the contractions of the all intercostal muscles, external, internal, and innermost. Contraction of these muscles approximate 2 ribs in the place of the intercostal space, and because of this, all ribs move up toward serratus posterior superior. On the contrary, during inspiration, during respiration, okay, breathing in superior posterior serratus posterior superior contracts, during breathe out serratus posterior inferior contracts, and by fixing lower ribs, okay, intercostal muscles, all intercostal muscles contract, and because of narrowing intercostal space, because of action of this muscle, I mean that the intercostal muscles, all of them, the all ribs move down, okay, go down toward serratus posterior inferior. Because of this, electromyography proves the action of the all intercostal muscles, external, internal, and innermost intercostal muscle during inspiration and respiration, during breathing in and breathing out. They are active in 2 conditions, but subjacent muscles like serratus posterior inferior, serratus posterior superior, scalene muscles, and the abdominal muscle determine direction of the movement of the ribs. Alright. Another things that I would like to show you, the levator costarum in this picture, and in this picture you can see brevis, levator costarum brevis, or short levator costarum, and the long levator costarum. You can see this is the long, arises from transverse process here. One slip attaches to the next rib, and another one attaches to the second rib. Alright? This is the long levator costarum. This is short levator costarum. Arises from spinous process and attaches to the next rib. Alright. I think that for 40 years. Levator costarum muscle. We've got 11 levator costarum muscles, but the subcostal muscles, we don't have 11 subcostal muscle, because they can find them in the lower part of the thorax. Levator costarum is outside of the thorax, subcostal is in thorax. Alright, but both of them locate on the posterior wall of thorax. This is the posterior wall of the thorax. Okay, and the serratus posterior, inferior, and superior as well locate. Okay, and the next muscle is the diaphragm. Diaphragm is the musculo-tendinous partition between thorax and the abdomen. Musculo-tendinous, muscular fibers and the periphery, and the fibrous tissue or tendon, and central tendon in the center. You can see in the center. You can see diaphragm consists of the two domes, left one, left dome, like a mosque, left dome, right dome. And as you see in this picture, right dome is higher than left one because of placement of the lever, right lobe of lever, okay? Because of this right lobe of lever, we've got the higher position of the right dome in comparison with the left one. Anyway, the all muscular fibers from adjacent areas are converged and will be end up at the central tendon of the diaphragm. This is the central tendon of the diaphragm. This is the Latin name, centrum tendinium. This is the Latin name, and the English name is the central tendon. Central tendon of the diaphragm looks like a clover leaf. Consists of the tertiary leaflets. Right leaflet, left one, and the anterior one. Anterior one is under pericardium and attaches firmly to the pericardium by phrenico-pericardial ligaments. Okay? And the periphery of the pericardium attaches with the fibrous tissue to anterior leaflet. And the name of this fibrous tissue, short fibrous tissue, is the phrenico-pericardial ligaments. Phrenico is the root term for the diaphragm. For example, you tell to a nerve, phrenic nerve, a nerve related to the diaphragm, because phreno means the diaphragm. Alright, as you see in this picture, the right leaflet of central tendon of the diaphragm is penetrated by this orifice. This is the foramen, vena cava foramen, or foramen vena cava in the Latin term, in the Latin manner. Okay, is perforated by a vena cava foramen, or another name, orifice for vena cava vein. This is the foramen for vena cava vein in the right leaflet of central tendon. Okay, the muscular attachment, some of muscular attachment of the diaphragm is sternocostal. I mean that arises from internal surface of the lower part of the sternum, xiphoid process, and the adjacent ribs. Arises from the internal surface of the lower ribs, and the sum of attachments arises from the vertebral column by two crusts, right one and the left one. This is the left crust and this is the right crust. Right one is longer than left one, okay, and arises from anterior surface of the body of lumbar vertebrae right one arises from L1, L2, and 3, and the left one arises from L1, L2. It's a shorter left one. They are crura. They are crura of diaphragm. Left crus, right crus. And the muscular fibers of the right crus encircle a foramen. This foramen is an esophageal hiatus or orifice or foramen, like a vena cava inferior foramen for inferior vena cava. But this hiatus or foramen is made by right crus, because, as I told you before, the muscular fibers of the right crus encircle esophagus, and the right crus makes this orifice for esophagus. Esophagus from thorax enters to the abdomen by passing through this orifice or hiatus. Okay, but the right crus and the left crus below to the esophageal orifice make this hiatus. This is the aortic hiatus for passing through descending aorta. Okay, for passing descending aorta. This is between right and the left crus. Okay, the level of the each orifice or hiatus is this. Hiatus for vena cava inferior is the same level with the T8. Esophagus orifice or hiatus T10, and the aortic hiatus is T12. Okay, it's better to keep in mind the level of the these orifices or hiatus is the important. T8, there is a differences number 2. T8, T10, T12. T12. This one for aorta, descending aorta. This one for esophagus, and this is for inferior vena cava. Inferior vena cava. And another muscular attachment of the diaphragm or origin of the diaphragm arises from medial arcuate ligament and the lateral arcuate ligament. Medial arcuate ligament and lateral arcuate ligament. These ligaments on each side arise from right crus to a spinous process of the L1, and from L1 to the tip of the rib 12. Therefore, from left crus to the transverse process of the L1, and from L1 to the tip of rib 12 on left side. This is medial arcuate ligament, this is lateral arcuate ligament on each side. It's the same. And this is another muscular attachment of the diaphragm. This is the sternocostal attachment. This is the lumbar attachment, and this is the arcuate ligament for excessive attachment. Sometimes between attachments we've got a abnormal hiatus, and because of this some intestinal loops herniated or is herniated to the thorax because of this gap or this. The most famous of this gap is the Morgani foramen or hiatus. This is between Morgani hiatus, if you can show you. And this is another view of the diaphragm. You can see inferior surface of the diaphragm, lateral arcuate ligament, and medial arcuate ligament. Under cover of the medial, psoas major muscle passes, and under cover of the lateral one, quadratus lumborum passes. And this is the right crus, and you can see some fibers of the right crus encircle a hiatus or foramen as esophageal hiatus. You can see. Therefore, esophageal hiatus, whenever asked question, esophageal hiatus is made by right crus of the diaphragm, and this is the left crus. Alright, anyway, and you can see some of the sometimes we've got a gap instead of having this trigonum. This is the triangle or trigonum. We say Buchtalek triangle or lumbocostal triangle. This is the weak point between thorax and abdomen, and sometimes we don't have any fibrous tissue here, and some loops of the intestine is herniated inside the thorax. And another alright, this one, and in other places, if I show you, in other places, this gap, Morgani hiatus. And if you have a defect here and intestinal loop herniates inside the thorax, we say Morgani's herniation. The location of the Morgani's herniation is here, between the sternal slip and the costal slips of the diaphragm. Okay, anyway, it's enough for today, and the next week I will tell you about the more details. I mean that I will talk about the vessels and the nerve in the thoracic wall. Okay, and now